So welcome to everybody to, joining us today. I want to introduce one of my esteemed colleagues who is a consultant obstetrician and lead for the birth centres at Guy's St Thomas's Foundation Trust here at GSTT. Her clinical interests include obesity, diabetes, pre-pregnancy counselling, early access to care and social complications in pregnancy. She has multiple titles and is a clinical lead for the Women's Global Health Clinical Academic Group at King's Health Partners. And she also has completed a master's in leadership, and her main interests lead around leadership and resilience. And she's very kindly agreed to talk to us today about staying afloat in the pandemic. And I'll let her take over today.
I am also one of the deputy medical directors in this organisation. Because we are so large, we have more than one of me. And within that, in my portfolio, I have professional development, quality improvement and resilience. And they all tie in very much together. And I say that purely because when I do these sort of talks, one or two people will inevitably contact me, which is absolutely fine. And please do, if you want to, you think I can signpost you or help you. And it's just helpful to put that context in. So my resilience work, I have been formally doing it now, it'll be 8 years. And I started doing it with the University of Westminster and Guy's and St Thomas's, working in partnership. And through that partnership, over the period of 18 months with the Resilience Collaborative there, built and designed a bespoke resilience program, initially actually for doctors. Since then, our partnership it has grown from strength to strength, and the program is now used for not just doctors, but it's used for other clinicians and for non-clinicians as well. And for the last it'll be 5 years in September this year, our organisation at GSTT is the only one where foundation year doctors have resilience training as part of their mandatory portfolio in their first 2 years. So the two bits that are mandatory that are unusual is around resilience, and the others around leadership and management. So this work in particular, I normally do these sessions with my partner in crime, Professor David Peters, who is professor at the Institute, in the Centre for Resilience at the University of Westminster. And so I'm just acknowledging that the slide set that we use is a joint slide set. So this works best with a bit of participation. So I'm going to get you guys to, and I may need, keeping afloat in a COVID world. It is, I don't know if you guys know, it's 433 days since we as an organisation went into COVID. So I just want you to take a few seconds to reflect on what keeps you afloat. And I'll use this analogy of this ship quite a lot throughout. What is keeping you afloat? And if any of you want to shout out just words or quick phrases, that would be good.
Yeah. So for me, it's my colleagues, family and friends, a regular yoga, someone else is saying.
Fantastic.
Being able to interact with my colleagues every day.
Yeah. Some face-to-face human reactions, absolutely.
Sorry, I was finishing my family time and eating dinner, which is what I couldn't answer, but that's probably the thing that's kept me sane in lots of respects, is going home and having someone sensible to talk to.
Absolutely.
Thank you very much again for your contribution.
Really, really important. Thank you. So there is a difference, isn't there, between that picture of the boat that's, I don't know if many of you sail, but you will know that you're just about keeping on top in the calmer waters on the right here versus the slightly more torrid waters on the left. And why is that important? Because resilience is a really difficult word. It's a poor word, but I and others don't have a better word for it. And it has connotations to it. So we've started to, over the years, talk about keeping afloat. Keeping afloat in our normal world, keeping afloat in a COVID world is particularly challenging. I mean, it's challenging for all of us. So you're keeping yourself afloat. How do you keep your team afloat? We're also, I'll flip between the personal and the sort of professional working life. So keeping yourself afloat, keeping your team afloat. are two different things. Now, resilience fluctuates, and people talk about going to resilience session or needing. Sorry, someone muted. They're not muted. Thank you. It does fluctuate. Okay, none of us, even those of us with the maximum resilience, it fluctuates, and that's normal and human. But we're more likely to crash when either the water levels fall or when the rocks get bigger. So that's that understanding of the context within which we exist. It is not just self. It is not just about you needing to be stronger and stronger and stronger despite what's happening around you. It is very, very much you within the landscape that you're in. So what factors push your resilience down? Either water level goes down, or what is it that you tend to do better, you cope better when something's pushing your resilience up? The rocks are going down, the water level's going up. So again, just if you could share your thoughts in the chat box, or again, just unmute and shout out. So the two things: what pushes your water level down? What pushes the water level up, allows you to cope better?
Water level down, seeing how almost everyone I know, especially right now in India, has or lost someone with COVID. Pushing the water level down. Yeah.
No, absolutely. There's a lot of sadness around us. Any thoughts on what might push the water level up?
Water level up, being able to interact with friends, colleagues, family. I think pushing water level down are things like when you feel like you're doing your best, but it feels like it's not quite good enough, or it's not making a difference, I would say. And equally level up, making a difference and feeling like even doing small things make a big difference, which I think is something that, especially at GSTT, has been, working collaboratively with everybody has been great. Yeah.
So there's this whole thing about purpose and meaning, and it is, I'm making the assumption that most of us on the call are medics. There is a huge amount to us in terms of professional satisfaction and resilience that ties into the purpose and the meaning of the work that we do. We inherently are unbelievably privileged because we do purposeful work. But in times, for example, within the pandemic, being able to enact that, to support your colleagues, to be able to do what we have done, which is phenomenal things for the patients that have come to us. We had the lowest mortality rates, we had the highest survival rates. Those are incredibly proud things, and that was entirely a Team GSTT effort. Those are things that have purpose and meaning. And that interaction, we've had several comments about the interactions with each other, and I just want you to hold those thoughts for a minute. So being able to map those rocks, I know I start getting a bit tired when such and such or such and such. I think in reality, all of us in the organization, including those who have been shielding or at home during the pandemic, are tired. I think that a lot of us are exhausted. But being able to map out those rocks, to avoid them, to understand what are your rocks, and your rock will be different to my rock, is really, really important. The reasons why your water levels rise will be different to my water levels rising. So there's a level of self-awareness here that is really, really important. So it's not just me. And often when we are feeling tired and exhausted and less resilient or burnt out, and we tend to think it's just us feeling that we're not strong enough as doctors. And again, there's very much this presenteeism in us. We are individuals who are competitive, we're high achieving, things have to always be perfect. The world just isn't like that. So this is just some of the stuff that's going on around us, and at the moment going on for the majority of us. Okay, competition, over expectation, modification, moral injury. You will have heard about people talking about that. The fact that you know what you want to do, but you can't do your best for each and every patient that you see, is termed moral injury. And moral injury isn't there just for clinicians, it exists for non-clinicians as well. So it's not just me, that we're front-facing, we have our patients, we have the system around us, we have the landscape. We have constant demands on us, either as individuals or as teams, or as a system or as an organization. And really that can then lead to issues within the relationships within the team. So is there a leadership vacuum? Is there moral injury? Is there fatigue? And I'd say that, that there's potentially all of that some of the time in all our systems. So the organization, and it's more so now, and I used to have a couple of slides to show why the system, i.e. the NHS, was being overloaded. I don't have to explain that anymore. I think every single one of you understands why the organization is adapting to overload. Okay, now we need to not just deal with the third wave, we need to also continue all of our elective work in exactly the same way, or maybe drop to 90% regard. Rapid uncertain changes. We've been in a state of volatility, uncertainty, complexity, and ambiguity, a VUCA environment during the pandemic, and it isn't abating just yet. I mean, it's been well over a year, and that takes its toll. So this unpredictable change and overload to some of us, those of us who by nature are a little bit more flexible, a bit more adaptable, may feel these impacts slightly less than those of us who like knowing what we're doing, who like knowing the data before you do it, like making decisions in an informed way. So the world and all of humankind, no more so than now, are adapting to changes in awareness about what's around us. How do we cooperate? What conflicts have existed? How is science contributing? A necessary reordering of what's important. If you look at the vaccination story, if you look at COVID, if you look at the highlighting of pre-existing inequalities, not just within our system, but within Europe and globally as well. There is a reordering that's going on at the moment. If you look at Black Lives Matters and the hashtag #MeToo campaign, we're at this societal change that does and will impact on us and our work. So the NHS is adapting to overload. The organisation is adapting to overload. Effective systems, rotas, resources don't always exist. And given the climate now, moving away out of that second wave of the pandemic, I suspect that things like rota gaps, which contribute significantly to our overload within the clinical teams, will probably get slightly worse. So again, going back to the it's not just you, there is a huge amount going on. And as doctors, the medical profession is particularly poor at discussing their own mental health. It is often seen as a sign of weakness. It is often seen as potentially a sign that may say that you're not really competent at your clinical work. So we don't tend to declare things until it is really, really late in the day. But understanding the sociocultural factors, understanding the environmental factors around us, the interpersonal factors, critically important. We are social creatures. Most of you, the comments we've had in have gone on about seeing your colleagues, being face-to-face, being able to meet up with people, having a cup of coffee or breaks with very, very important. And then there are the systemic factors as well. So why do we respond in the way that we do? I just want to go back very quickly because we're short on time, so I don't have a lot of time to go back into the biology, the neurobiology of resilience. But we basically have three brains. We have our lower brain, the basal part of our brain that's doing our breathing and our basic activities to keep us alive. We have our midbrain around the amygdala. And that is a very much an emotional part of how we respond to things. And it has been programmed a long, long time ago. For most of us, programmed in our very early lives as babies or in our early childhood. And that enables us to respond incredibly quickly, which used to be very important for us. And it also means that you can misread signs. So just an emotion is provoked in you. The front bit of the brain, which is the third part of the brain that I wanted to talk about, the prefrontal cortex. So if you folded your hand in a fist, it would be the bit around your knuckles. That bit is the bit that rationalizes thought, that processes data, that recognizes patterns, that enables you to think through stuff and work out if that really is what you're seeing, and is it concurring with what you're feeling. That gets very, very quickly overwhelmed by the amygdala when you have an amygdala attack, and some of you may have heard of that before. So when an emotion takes over, when you see something, a piece of rope on the floor, and you think it's a snake, and you've had a previous bad experience with a snake, your brain will read it as a snake and you will jump before you're able to rationalize it. And that's really, really good when we're out there in our caves, when we're out there in the woods hunting. It's not so good doing the jobs that we do. So what happens is that we need our prefrontal cortex. That is what we rely on as doctors. It enables us, as I said, to do that pattern recognition, deal with complex data, take a history, make a diagnosis, examine, corroborate the information that you've got. It enables you to communicate in the best way possible with your colleagues. All of these are dampened down when the midbrain, the amygdala, is overtaking, when our emotions are overtaking, or when we have persistent stress that doesn't allow our cortex to function normally. So what happens is that persistent stress makes us ill, ultimately, but first it makes us really error-prone and unfriendly. And error-prone is not good in your and my business. So what happens is that there's a cortical inhibition, so the increased activity in the amygdala, which is your stress center, fight or flight. It decreases the activity in the cortex. You can't quite think as well as you do. However, if you then have cortical facilitation, i.e., you'll decrease your amygdala activity, and we'll go through a little exercise very shortly that will show you how you might try and regulate this, then you can increase your activity in the cortex. But what is really important to know is that we're not all functioning at high cortical activity. There are fluctuations in that. Recognizing that you're fluctuating and you're at the lower end of it and you need to boost it, whether it is in a day's work or around a shift or in an hour of a clinic, you need to have that level of awareness. So some stress enhances performance, and I'll show you a graph in a minute. But if it goes too fast, then what happens is you will start making mistakes. So performance increases slightly when the body gets activated, but only up to a point. If it continues, if it is persistent or it is too high, then what happens is that you slow down. Your thinking slows down, your processing slows down. So too little arousal also undermines performance. So what is resilience about? It's not about constantly being able to go on and on at all costs. It's about staying afloat with life's up and downs. It's about staying afloat with work's ups and downs. So when life and work drain you, how do you recharge? Might just take a second there. I've spoken a lot in the last 10 minutes just to see what sort of things do you do to recharge when your batteries are down a bit?
For me, it's again, people and spending time with family and friends and colleagues and breaking down everything. Reading a book, someone says.
Several things.
Video games with friends online.
Yeah. Well, this is part of it, isn't it? We haven't been able to see our friends and families as we normally would have done. We haven't been able to hug each other as we normally would have done. Time is short. Sitting down to read a book, maybe not so much time.
Getting outdoors, baking, so all the taking long walks outside, especially when it's sunny.
Yeah, nature connection is really important. Again, that's something that I'm particularly interested in, and we've looked at academically as well, this nature connectedness, but I hopefully will have a few minutes at the end to tell you about it. So the human function curve, being used by athletes and their coaches for a long time, very, very relevant to us. So if you think about the x-axis being effort and arousal and the y-axis being performance, in the drone zone, when you are waking up, when you're a little bit tired, you're starting to wake up slowly, your effort, your arousal increases, the tension's increasing, your performance is improving. And then you get to this bit, which is the C zone, the creative zone. When you have just the right amount of arousal, your performance is at its best or heading up to its best, Your pattern recognition is at best, your communication, your ability to process complex information, a really, really good place to be in. And that's called the creative calm. That's also where our minds are at their most creative, at their most innovative. But if you keep with that arousal and you do not recover and recharge, what happens is you go past the peak and you come into this fatigue zone, okay? And what happens with the fatigue zone that is particularly dangerous is that you think your performance is continuing to increase, but in actual fact, the performance is crashing, and you don't have that insight into what those changes are. And given the fact that we don't easily talk about resilience and burnout and fatigue and the human performance curve with each other, others may see it in you, but they may not be able to express it. We need a common language for us to be able to feed back to each other without getting upset, knowing that we're helping others, not impeding them. And what eventually happens is if you keep on with the arousal, you don't stop, you don't rest, you don't regenerate, you don't recover, is that you get into the panic zone, you start getting unwell, and then you get into the breakout and burnout zone. And these zones are awful zones to be in, purely because to get out of those zones, once you've got in there, if you haven't sort of managed to edge back up the curve, it takes a long time. And again, I go back to the fact that doctors don't like self-identifying. They don't like declaring that they're not feeling good. They don't like saying that they're really not quite at their best. In my roles in this organization at the moment, when I meet people, I always say to them, and how are you after the pandemic? And it's fascinating how all the doctors, irrespective of how senior or junior they are, they go, oh, we're fine, we'll be fine, we're absolutely okay. But I think my nursing colleagues or my AHP colleagues need help. We're really, really poor at having that insight into ourselves and our performance. So if you just give it a little bit of thought, a few minutes to just think, a few seconds actually, to think about where you think you might be on this curve. And it isn't a static thing. So you might find that actually you're going between the fatigue zone and the C zone, or you might find that you're going between the panic zone and the fatigue zone. So this is a really dynamic situation. This is what we mean by resilience fluctuates, performance fluctuates. That's entirely and totally normal and human. What isn't good is that we ignore it or that we don't recognize those signs in ourselves. I wanted to talk about burnout because inevitably when I do, and David and I do these sessions, there are people who will be at various stages of that performance curve. And I think it's quite important for us to talk about what burnout actually means. So burnout, it is a distinct state. You can diagnose it. You feel overloaded. You feel like you have a lack of control over what you're doing. You feel you're not rewarded for the work you do. You might be experiencing a breakdown in your community. You feel you aren't treated fairly and you have to deal with conflicting values. And that conflicting values in particular, I want to talk a little bit about because that's where that moral injury comes in. So during COVID, in the first wave, we entirely and totally focused on COVID patients. Many of us now know that many of our other patients on waiting lists, our P1, our P2 patients, were coming to harm. The focus was on COVID. In wave 2, we tried to marry the two, that manage that tension a little bit better. Those are conflicting values. Those are things that really can affect our resilience as clinicians. So what do you do? Oxygen mask in a plane, they always say you need to help yourself before you help others. So you need to keep calm and practice self-care. Self-care for many of us it is a fairly alien thing. We are very used to caring for others. We're very used to having the answer for others. We're not so good at acknowledging that we need self-care and that we need a bit of me time. So your resilience is really about this balance between stress and recovery, They're both things that you can't get away from stress, but how you recover and how frequently you recover so that you're in the balance is really, really important. I'm just going to give you a second to look at the drainers around resilience and looking at the drivers of resilience. So one of the self-care tools that we talk about is the emotion dashboard. If you think about our mental state in terms of if you look at what here is on the y-axis, we've got sympathetic nervous system activation. And below that, we have parasympathetic nervous activation. So one is making you go faster, one is slowing you down. On the right side, we have when you are feeling like you are hunting. So you're out there, you're very purposeful. On the left side, you feel safe on the right side. On the left side, where you have the hunted, you're feeling unsafe. You're not certain about your environment. And what I want to do is to discuss these 4 different colors, which is the emotion dashboard. So in the top right, when you have the right level of arousal, when you're feeling safe enough, but you've got just the right level of tension, you are hunting, you are in your green zone, whatever it is that you're doing. So if we look at us professionally, the surgeons, that's when they're in the flow, when they're operating, the pains are falling away, there's no unnecessary bleeding, everything's just going, that's being in the flow. And I'm almost certain that all of you will have an example of when you're in the flow, either professionally or in your domestic lives. And then when you go down, that's when you have that level of activation. When you're more still and you're recovering, that is when you're resting, tending, and befriending. So that's that social thing that we've been talking about, that green zone. But if you move to the left side of this, at the top, you have a high degree of arousal, but you feel unsafe. You feel that you're being hunted. That's a red zone. You can be in that zone for a set amount of time, but then you need to move into either the blue zone or the green zone to regenerate. And if you continually on the red zone, what eventually happens is you go into that bottom left-hand corner, which is the overwhelmed, burnt out zone. So just giving a little bit of thought to where are you right now? Where are you feeling at this particular moment in time versus where have you spent most of the week? And it may be actually that you've gone between the blue and the green, or that you've gone between the blue and the red, or that you've gone from the red down into the overwhelm. And again, just being a little bit aware of this emotional dashboard. Normally in sessions where I can see you and we have a little bit more time, I'll give you a bit of time to think through where you might be, to do a bit of reflection. And what we then say is when you're in this, or on the left side, the hunted and overwhelmed zone, what you need is when you really are feeling out of control, if you're falling out of a plane or the plane is falling out of the sky, you want your parachute, okay? But it's no good trying to use the parachute for the first time when you're spiraling out of control. So don't wait too late to start practicing self-care. If you practice it, and I'm talking about practicing your breathing, about a degree of mindfulness, you don't need to sit there doing it for half an hour every day. It is literally practicing it for a couple of minutes a day, extending that time a bit. If you keep practicing it, it becomes a habit and you can engage with it when you feel you're in that red zone or the green zone, the hunted zone or the overwhelmed zone. And in practice, in a long shift where you're having a busy time, you're feeling overloaded, just taking 5 breaths is really important. It can reset that whole parasympathetic, sympathetic system. And it then changes the feeding to your amygdala, which then enables your prefrontal cortex to be functioning better. There is amazing science to breathing. Okay? It's not all just a bit of fluffy wool. Some of you, I am sure, certainly people have been talking about yoga or practicing mindfulness will be doing that to some extent. If you're not, please give it a go. And if you want to have a go, then try the Headspace app. It's being offered at a discounted rate by the organization at the moment as part of our wellbeing offer. So the reason we've put this up is just to show you that if you're constantly functioning at this really high level of arousal, just continually going, the faster you are going, the longer it takes to stop. Okay, this braking distance and the stopping distance is really important. So, and that means that if you've been going hard at it for a long time, like almost all of us have in the last year, it takes some time for you to reset. It takes some time for you to regenerate. And that stopping distance will depend on your attention, your thinking time, the road surface, the weather conditions, etc. This is why the rocks and the water level, that's the analogy, understanding where you're at and where the system around you is at is really important. And what we're really keen to do is not just to survive, not just to keep your head above water, but if you're working here, if you're a permanent member of SUP, we want you to be at your best for as much of the time that you can be. Because it's good for you, it's good for us, it's good for our patients. So to flourish, which is what we want you to be flourishing and to be thriving. When you're running too hot, when you're losing control, you need to pull over. When you're running out of juice, you need to pull over, you need to fill up. What's going on under the bonnet really is that bit about the emotional dashboard. Okay? Your stopping distance will depend on what's around you. Needing to know when you need to stop and what you need to do is part of it. So just finally, looking at our capacity to perform well under pressure. These are just some of the things, okay? If you have a lot of negative inputs, stress, internal conflict, time and energy demand, being really hard on yourself, your coping reserve will be drained and you will end up burning out. If, however, you have good positive input, psychosocial support, you have social and healthy lives, you have mentorship, you have a safe space to go and talk to people, you have the right level of intellectual stimulation, that purpose and meaning I talked about at the start, then you will bump that up and you will be more resilient. But this isn't just about the individual, as I said, it's also within the system. So are you getting enough cave time, and what are you doing in that cave time to maximize the cave time that we have? Unfortunately, during the pandemic, our cave time, which is our connecting, resting and digesting, literally and metaphorically has been taken away from us. So I'm going to stop there for a minute. How many of you practice some form of breathing or mindfulness relatively regularly or regularly?
One person says they do, another person says about headspace before bedtime.
Perfect, well done. Yeah. Okay, so what I'm going to do is I've got me on the screen now. I'm going to ask you to just do an exercise with me. For those of you who practice it relatively regularly, just bear with me, do what you normally do. For the others, I wonder if you don't need to be in a quiet, dark room. You can be sitting or sit either on the floor, on your chair, or on your bed. If you could just get your feet grounded, just feel your bottom on whatever you're sitting on. Cross your hands or just rest your hands gently on your lap. And I just want you just to be aware of your breathing. How fast are you breathing? How deeply are you breathing? Is it just into the thorax? Is it a much deeper breathe into your tummy? And then I gently invite you to close your eyes. I'm going to do it with you. And I'm going to invite you to try and give, you may have heard of the monkey mind. The mind is going with all those things that you need to be doing, that you hope to be doing. But you're going to give your monkey mind something to do. And I just want you to count the breaths. If you count a breath in as 1 and a breath out as 2, a breath in as 3 and a breath out as 4. And if you just continue until you get to 20 and then just start again. Very gentle breaths. You can close your eyes or you can keep your eyes open. I just want you to feel how it feels to be slowing your breathing down, in and out, in and out. And in that rhythm, so when you do about 6 cycles in a minute, you put yourself into a sinus rhythm. You put your calming down your sympathetic nervous system, and the parasympathetic system is being facilitated. If the mind wanders, just come back to the counting of your breath. Just a few more breaths. And then can gently just come back to yourself, feet on the ground, feeling your bottom on whatever you're sitting on. Just release your hands, wiggle your fingers a bit. Gently open your eyes when you're ready. Just a little look around. It's something we do traditionally when we came out of the cave. We look around to make sure everything's all right. And then if you just come back into the room, be really, really keen to get some feedback about how that very, very short breathing exercise was for those of you who did it.
Very calming, very relaxing, definitely. That was extremely relaxing and calming, someone else says. Yeah. I think it immediately just separates you away from what's happening, so it's quite nice.
And really to demonstrate to you, if you, and there is science that the neurobiology, again, if you're interested in this, we run half-day sessions through the School of Improvement. They're all free for all of you. You just need to log on and register. Then we do a little bit more of the practicing, and we also have a much more discussion between you about stuff that you do that helps your resilience and stuff that you do that doesn't help it. Because I suspect most of us are probably cycling between the C zone and the fatigue zone, or the exhausted zone. So just practicing that, the ability to do that, to take 5 out of whatever it is that you're doing, to reset your mind, calm down your amygdala, enable your prefrontal cortex to be at its best, can completely transform conversations, interactions, communications, okay? That's with each other, and that's with our patients as well, because we're much more receptive to actually listening to and hearing what they are trying to tell us, as opposed to rushing on ahead to make, for example, the diagnosis before you've got all of the history. It's a very quick, very effective, scientific way of resetting yourself, and that really is for me one of the important 3 tools that we teach you on the resilience course. But that emotional dashboard, just being a little bit aware of where you're at, and doing a little bit more of what you're needing to do, is always really, really helpful. So my thanks to all of you. I'm going to stop there. I'm going to take any questions if you have any questions. I
think the question, I suppose, I mean, it's for anyone who's sort of in a clinical lead role, it's very difficult. I think one of the things that I find very hard is that need to deliver a clinical performance, let's say a clinic, and the ability to feel that you're offering yourself anytime to anybody, but at the same time not necessarily having that clinic door open for everybody. And I found in the last few weeks particularly, it's this sort of patient goes out the door and there are 3 people waiting outside to come in and ask you something, and it's very difficult to say no, because of course you want to offer them that opportunity, but it is very difficult.
I suppose, Chris, there's a thing about us all just being a bit kinder to each other and understanding as well. And when you're at your best, 3 people outside the door when a patient just walked out is probably doable. But I suspect we are all pretty tired and exhausted, and our ability to perform at that top of that curve, which is always our expectation of each other, just resetting that a little bit, slowing down a little bit, doing that as a team can sometimes help. One of the things David and I always do with these sessions is we've started trying to get people to think through how they might incorporate this. I mean, wouldn't it be quite something else if we all managed to do a bit of parasympathetic breathing before we did our handovers, if we managed to do a bit of parasympathetic breathing at the end of a shift, for example. But you know, it's emotional hygiene. We come into various parts of our working life. We all have other lives, and that emotional hygiene, that washing of your hands, that washing of your emotions, either between one patient and another, talking to one colleague and another, being able to do that fairly quickly, fairly efficiently, using parasympathetic breathing is really where I would like us to be in the future. Emotional hygiene, really, really important, because the work we do is emotionally demanding. The work we do calls on our emotions, and if it didn't, then you would be worrying about that as well. So I think maybe acknowledging that. But thank you for sharing that, Chris. Thank you. Thank you. Any other comments? Oh, thank you. Please do leave some feedback. My apologies for rushing through stuff. The neurobiology is really, really interesting, and particularly so for medics, because we naturally like to challenge and like to have the evidence there. So if you're interested in that bit, then please do come into one of the other sessions. So it just remains for me to say thank you very much for inviting me and for giving me 45 minutes of your very precious evenings.